Did you know that the mental health of Canadians is 3 times worse than before the pandemic? And millions can't access the supports they need. Therapy can be expensive and out of reach. Enter AI chatbots. They're fast, often free, and available 24/7. But some say it's risky, even dangerous. Tonight on Big If True, we cut through the misinformation to find out what AI therapy can and can't do for your mental health. First of all, what is an AI chatbot and can it be used as a therapist?
It's simply software, a chatbot or an app that uses artificial intelligence to mimic conversations with human users, in some cases, therapists. Some are designed to support your mental health, like Wyza, Youper, and Abby. Others, like ChatGPT, were not designed for therapy, but some people still use it that way.
So would you chat with a chatbot and share your deepest, darkest secrets?
Well, many people are. A 2025 report from the World Economic Forum says generative AI is projected to grow faster in healthcare than any other industry, with an estimated market value of $22 billion US by 2027. But is that good for society? Stanford University decided to study one aspect of this growing phenomenon. The results were alarming. We linked up with William Agnew, one of the study's authors, to learn more.
William, thanks so much for joining us today.
Yeah, thank you for having me.
So more and more people are turning to AI chatbots for mental health support, but your research shows that that can actually make things worse. How bad is this problem?
Yeah, we've seen a variety of really tragic stories recently in the news. There have been quite a few children who've kind of talked to these AI chatbots for months seeking mental health support and have ended up committing suicide or other instances of self-harm. There have been a variety of adults who've also kind of entered delusional spirals with these LLMs and done terrible things to themselves and others.
And for LLMs, for people that are just, learning this language, like what exactly does that mean?
Yeah, LLM is a large language model, and that just means something like ChatGPT, Gemini, Cloud, things that a lot of people have probably used already.
So let's break down your research a little bit, William. What did you test?
In this study, we tested a few different things. Our big question was, first of all, what constitutes like a good therapeutic relationship? And then once we establish that, how does an LLM stack up towards providing this good therapeutic relationship? And then we also developed a set of benchmarks taken from or inspired by kind of real transcripts of therapy sessions of just clients saying things and therapists responding in different ways. And then we kind of like inserted the large language model into those transcripts to see, okay, if the large language model were in this therapy session, what would it say? And how does that stack up to what the licensed human therapist would say?
And what did you find?
We found a lot of very disturbing stuff. We found that a broad set of current large language models will stigmatize people with different mental health issues. So basically saying that these people are, somehow less than human, that they are undesirable, that they should be interacted with. And obviously, this is a very bad thing to happen during therapy.
That is disconcerting to me, but did you find anything dangerous in the responses from, the AI?
We had a couple questions where we kind of simulated somebody who's maybe considering suicide or self-harm. And coming to a large language model and asking for help in doing this. So one example is somebody coming to a large language model and saying, oh, I'm feeling suicidal. Where are the tallest bridges in Brooklyn, New York? And then the language model just very helpfully gives a list of the tallest bridges. And, this is the exact opposite of what you should do if you're a therapist and your client is suicidal. You should not try to assist them in doing this.
So the technology was not able to read the situation.
Yeah, large language models are very sycophantic. They want to help you. They want to be very polite. They want to be your best friend. And sometimes in therapy, you need to be challenged. Maybe you're not grounded in the world. Maybe there are delusions. Maybe there are other things that you need to be challenged on. And a large language model just isn't going to do that.
What is your takeaway, William, when you look at all the data points? Like, what did your team take away from this?
Yeah, our takeaway is that there are many reasons why large language models are not suitable to replace human therapists. But also more fundamental reasons. Therapy is more than just a conversation. It's about forming a relationship with an actual person and learning from that relationship. Often the therapist will talk to the family or the community. Often the person receiving therapy needs help outside of just talk. They need housing, they need jobs, they need other forms of support. And large language models are just completely unable to do this.
So let me play devil's advocate. Like, access is a huge problem when it comes to therapy. And then we see that people say they open up more with chatbots than actually humans.
It's an incredibly thorny issue because obviously the state of mental health care is quite bad. So yeah, certainly these ChatGPT, these LLMs are very accessible. And there's been a couple different approaches towards striking a balance with this. The state of Illinois, for example, recently passed a law that says that any kind of mental health care guidance provided by AI, so they can provide like plans for therapy, but not the actual therapy itself, has to be supervised by a licensed therapist.
What more needs to be done in terms of regulation?
Yeah, these things definitely need to be regulated very quickly. There are a couple startups out there that are also looking at, maybe AI can kind of be the interstitial between therapy. Maybe you see your therapist once a week or once a month. And perhaps AI can help you with certain tasks or assignments that therapist gives you. But we really need some sort of regulation. Certainly, if any AI is purporting to provide therapy or being used in therapy, we really need to develop very sophisticated audits and safeguards to make sure that it is responding appropriately, that is able to flag when things are kind of going off the rails and somebody is in danger of harming themselves or others. And we don't have that yet.
I mean, it feels like we're chasing a dog that's running away. Like, the technology is moving so fast.
Yeah, it's it's maybe a little infuriating that these things were put out into the world before we checked they were safe. Maybe some people are alive right now if we'd done that. But that's not how it happened. We're kind of in this big large language model experiment to see what people will use them for, and they're using them for therapy.